Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Opioids. Opioids are analgesic. Opioids are used in analgesia. So opioids acts on receptors mu, kappa, delta, and nociception. So these receptors are present in supraspinal, spinal cord. In the spinal cord, these receptors are present in substantia gelatinosa of dorsal horn cells of spinal cord, and these are also used in extra CNS sites. At higher doses, they are used in NMDA. At higher doses, they act on NMDA receptors. Next, action on different receptors should be dealt properly. Action on mu1 receptors. On mu1 receptors, opioids causes analgesia, bradycardia, meiosis, urinary retention, and muscle rigidity. On mu2 receptors, opioid causes respiratory depression, constipation, and dependence. On kappa receptors, opioids causes analgesia, that is mainly spinal analgesia. Opioids also causes respiratory depression on kappa. On delta receptors, opioid causes analgesia, that is mainly spinal analgesia. On nociceptin or orphanin receptor, this is an receptor or endogenous opioid. So this nociceptin is activated and it is used in acupuncture. It is used in acupuncture.
Summary. Opioids are used in analgesia. Opioids activate NMDA receptors. They also activate mu receptors, kappa receptors, delta receptors, and nociceptors. All these will act on supraspinal, spinal cord, and extracranial sites. Supraspinal, they act on substantia gelatinosa of dorsal horn cells. So their important actions: mu1 causes analgesia, bradycardia, meiosis, urinary retention, and muscle rigidity. Mu2 receptor acts on respiratory depression, constipation, and dependence. Kappa receptor is important for analgesia and respiratory depression. Delta receptor is important for analgesia, and nociceptor or orphanin HQ is important for it is an endogenous opioid and it is important for acupuncture.
thank you and thank you for watching.